Call the Human Services meeting to order, please. First item is approval of the agenda. The chair will entertain a motion.
So moved. Support.
I heard Snell and support by Williams. All in favor will please say aye.
Aye.
Any opposed? Thank you. We're up to public comment. Is there any public comment today? Public comment is now open. Any public comment? Public comment is now closed. On to committee items. The minutes are up first. Chair will entertain a motion.
So moved.
Thank you, Commissioner Snell, and
Support.
thank you, Commissioner Bear. Any comments on the minutes? All in favor will please say aye.
Aye.
Any opposed? Thank you. We're up to appointments, of which we do not have any today. And now on to the medical care facility financial statements. We don't have anybody here from the medical care facility. The financial statements are there for commissioners' review. Give you a couple seconds in case anybody has any observations. Chair will entertain a motion to receive the financials from the medical care facility.
I'll move that.
Thank you, Commissioner Alexander and Commissioner Snell supporting. All in favor, please say aye.
Aye.
Any opposed? Thank you. Now we're up to the R2 AAA semi-annual report. I'm sorry, I missed the Department on Aging. Holy mackerel, and there's Danielle sitting so patiently waiting.
Thank you.
You thought you were almost off the hook there.
Well, they're
We like hearing from you. Yours is always a yes. Yours is always a pleasant report. We like to hear it. Take it away.
okay. Well, good afternoon. And for the month of May, I just kind of wanted to highlight some different things that are going on at the Department on Aging. We're working on our Senior of the Year nominations. This is up on our website, so people can go ahead and access that. It is something that we're always excited to honor a senior in our community that has given back through their volunteerism. So we're sending letters out to the community organizations that we work with. Put it in our newsletter. We're going to different community meetings just so that people are aware of that. So if there's anything where you're going to a meeting and you know of individuals that work with volunteers, let them know that this is something that they could nominate an individual for. So it's to recognize that person that is 60 or better and has done things for individuals in our Jackson community. So our advisory board will review those applications, and then we'll work with the human service members to honor that person and get that information ready for the August 8th fair. And the deadline for submission is June 17th. I also wanted to recognize Older American Month. So the month of May is a time each year where they recognize older adults nationally. And the theme this year is Age My Way, which is really a focus of us. I was excited about the theme because it's really talking about living independently in the community as long as possible. And that really is the mission of the Department on Aging as well as the Region 2 Agency on Aging. So it's definitely something that we're getting the information out about so people are aware of that. So again, every month they pick a different theme, but this is a great theme. So just wanted you guys to know that. With our activity programming, there's different stats that we pull all the time, and I think I've come here and I've mentioned several times, I think we're seeing like new faces and new people are coming into the senior center and participating in our programs. So I kind of ran a number from January through April, and we had 226 older adults that were either a first-time user of an activity at the Department on Aging, or they tried something new. So we track like 8 different different categories of activities, whether it's for exercise promotion, whether somebody's coming in just for like our dinner dance, which is an activity that's in the evening, the only one that we do. And what we look for is that crossover into another activity. So it's one of our performance measurements. So somebody might come in for an art class. Maybe they just come in for Bible study or a low vision group. So again, we're looking to try to see if we can have that crossover. So I thought it was really interesting too, within that amount of time, I think as the reopening's happening and people are getting out more, that again, we're seeing new people or people that are participating in more than just one activity at the center. And of course, I always like to say, who's the oldest person, using the services? And in this particular service category, the individual is a 93-year-old male participant that's coming in and using activities. We're also working on our volunteer luncheon, which is on May 20th. It's a great opportunity for us to recognize the volunteers at all our various sites. So there's always a lot of things that happen behind the scenes as you're having a congregate site or a senior center, people that help with an activity, whether it's, helping to clean up or set up, or even our Medicaid, Medicare assistance program, our volunteers with that. And so we kind of have all of our sites come together on May 20th, and we're doing that at the Human Services Building. And we honor our volunteers, do a nice luncheon, we have entertainment, and welcome, of course, anybody in the community is able to come. Of course, 60 and older is the target audience for us. But we're also using that opportunity to recognize an agency or an organization that has worked with older adults and helped in the betterment of their lives. And talking with the staff at our departmental staff meeting, really, trying to figure out that organization this year. We picked the Community Action Agency through their VITA program. They work a lot with volunteers that help to prepare taxes. They had a great coordinator, Tammy Farnham, that was very engaging with the seniors that came into our building, helping to answer questions, a great support to the volunteers that were coming in. And so we thought it would be a great opportunity to recognize those volunteers and also the coordinator of that program. So staff just heard wonderful things, even just the way they were just helping seniors through difficult times and things like that as they're coming in. So if you're able to attend, we'd love to have you. We're also working with CoPro right now on a request for qualifications as a food distributor. So that is up through May 20th right now. And then we're going to be bringing information back to Human Services on what those bids came in and projecting out what benefits there might be for us to move from Van Ierden or stick with Van Ierden. So it's a time for us to relook at what we have in place, make sure that we're getting the best for the dollars that we're paying for the service, and any incentives that, a company can help us to lower cost or ideas or things like that is things we'll look for. I also wanted to just mention a moment of excellence I put on here. One of our meal transporters had come across a senior that had fallen in his yard, and we were able to contact the son, and he was ever so thankful because he'd been trying to reach his father and was not getting an answer. He didn't know what was happening. The sad part with that is that senior actually did pass away, but the son called us after and was so thankful that the driver had found him and that the family could be with him at the hospital during that time. So, it's those kind of connections where, it may not always have the best outcome, but, that support that we can provide to the family, and those check-ins are just so important. So, any questions?
Questions for Danielle? Okay. I'm going to try and get to the luncheon on the 20th. I've got it on my calendar.
Okay, thank you.
Okay, thank you for coming in today.
All right, thank you.
Now maybe it's the R2 AAA. Yes, it is. Thank you for being here today.
Yeah, good afternoon, and thanks for having me today. I'm Julie Weatherby, the CEO at Region 2 Area Agency on Aging. You should have my report in front of you, and this lists spending for the fiscal year 2022 through March 31st. And so this is the amount that has actually been spent, not the total awarded amounts. So you can see, the amount of funding that we provide in Jackson County for community services and in-home services. We also supply some funding to Catholic Charities that helps with transportation in Jackson County. And then we also provide some money to legal services, which helps in all three of our counties we serve, which is Jackson, Hillsdale, and Lenawee counties. Below on the report, you can see the number of clients that we've served so far in Jackson County, which is 453 clients for our My Choice Waiver Program, which is one of our bigger programs that helps folks that are eligible for Medicaid and then also have a need for service and qualify physically for that program. It's an alternative to being in a nursing home, so lots of folks like to stay in their homes as long as they can, and we count on support from the Jackson Department on Aging to help with meals and other things that they provide for folks to stay in their home. But it is a big program, especially during the pandemic. We were able to help folks, avoid nursing home stays so that they could be in their home and get services there. We also have another program called Tiered Care, and you can see the numbers listed there. And that's a program where we keep in touch with folks in different tiers. Maybe they don't qualify for the My Choice Waiver Program, but we offer case assistance, and by that I mean we help them manage finding resources in the community and can set up things like PERS units and other things with community partners, as well as the Department on Aging help make that warm contact handoff for Meals on Wheels and other things that they may need. We've assisted so far this year 20 folks in Jackson County with nursing facility transitions. And this is an important program. It's something where we can help folks that maybe don't have support in their lives to help them get out of a nursing home and move back into the community. And sometimes while they've been in the nursing home, maybe they've lost their home. And so we help them find an apartment or another suitable setting to move back into the community where, they, of course, want to be. So that's an important program that we offer. For information and referral calls, we get lots of calls to our agency. Many of those refer to the Jackson Department on Aging or other community partners. But so far this year, through March 31st, it was just over 2,300 calls from Jackson County residents needing assistance. We've seen that number increasing. For those of you that don't know, or most of you probably do, the number of older adults in our three counties is rising. And so the needs for services from ourselves as well as the Department on Aging are just increasing. We've had to add additional folks to our frontline staff to help take those calls to make sure they're getting the supports they need. One of our other important programs is our Medicare Medicaid Assistance Program. And we've had over 2,000 contacts from Jackson County residents, and we've saved folks over $650,000 with this, conflict-free options counseling on selecting Medicare choices. We're especially busy, and we have counselors, at the Jackson Department on Aging too, as well as in our own offices, but they offer independent counseling on Part D plans for Medicare, as well as people that are new to Medicare, having a place to call where, we're not trying to sell any insurance programs, we're just trying to help people find the best plan that's helpful for them. We're in the middle of our multi-year plan process. Every 3 years, through the Older Americans Act funding, we have to do a multi-year plan. And so we are, coming up to the end of that process, but we've held many hearings. We had one at Jackson Department on Aging, and we attended that, where we get input from seniors in all of our three counties on what they see as needs for the upcoming plan. The plan lasts 3 years, and so this is a year where we write the 3-year plan, and then each year we offer an update to the plan if needed. We do have another public hearing if you're interested in attending at the Grass Lake Senior Center on May 18th at 12:15 p.m. And that's where we have staff there to help facilitate the conversation, but just for folks to be able to offer input into what they see as needs in the community. We have to turn in the plan to the Aging and Community Living Supports Bureau by June 24th, and so we are busy getting that all ready. Then what happens is our plan is taken to the aging commissioners at the state level. We go and present that in person either in August or September, depending on the time that's assigned to us, and then we present the plan, and then the commissioners there have to approve it. So we're doing well there. If anybody hasn't had a chance to complete the survey, we also have an online survey out there right now. If you all see needs in the community, you're welcome to take that, and I can forward that if anybody's missed filling out the survey. Other things that are happening at the Area Agency on Aging, May is our time of year when it's our annual meeting per our bylaws. So on Thursday, May 19th at 2 o'clock, we're having our annual meeting, and that's where our Board of Directors elects new officers for the upcoming year, and we announce the officers and talk about what's happened. And we also put out an annual report, which we'll provide to you all. On the 20th, we're having a celebration, and this year it's quite a celebration. Our board has been working on plans for over 2 years to build a new building site for us, a new building. We were lucky enough to have Dr. Cole and his wife donate a piece of property that was just kitty-cornered from our existing office, and then our board has been working with an architectural firm called Progressive AE out of Grand Rapids, and we've done a study for 2 years, and we're moving forward with that new building. So lots to come on that. We're excited. It's going to have 3 stories, over 24,000 square feet, and we're really looking forward to having that space for many years to come. It's going to provide a central location for seniors in our 3 counties to come and get services. It's going to be more accessible, a safe place, a confidential space for community members as well as our staff. Just a little history for our staff. When I started almost 15 years ago at the Area Agency on Aging, we had 25 employees. Now we have 64, and so it just shows the need and the growth that we've had for our services in the 3 counties. We recently completed our annual audit, and we had no findings for that. I'm just looking at some notes here. During the month of June, you'll be hearing about our Safe Haven program, which is a program that we developed a few years ago now that provides services and supports to older adults that have been abused, neglected, or exploited. We, through case management, offer a temporary housing situation. Many times people in those situations need a place to stay and land, and while we help work through resolving whatever the issues are, finding them a new place to live or whatever's needed. So during June is, National Elder Abuse Prevention Month, so we always do our event. We do a fundraising event because we get a couple grants to cover that important program, but it doesn't cover all of the expenses, so we do a fundraising event, and this year we will share all the information about that, but it's an annual event that helps support that program. The other thing I just want to talk about briefly is our, Danielle mentioned it's Older Americans Month. During our association, the Area Agency on Aging Association of Michigan, always has an Older Michiganians Day, and that happens to be this week on Wednesday, where many seniors gather at the Capitol and advocate for the needs of seniors in our 3-county area. This year it's going to be a little bit smaller. We weren't quite ready to bring busloads of seniors to the Capitol lawn yet, but there are going to be representatives from all the area agencies on aging throughout the state, and we're going to advocate for our priority issues this year. So they include, to support and strengthen the direct care workforce. I'm sure you've read a lot about that. There was been premium pay offered by the state, which goes out there, but our direct care workers are so key to keeping people working in their, or living in their home, and it's an important function. So that is one of the priorities. The other is rebalancing community-based long-term supports and services. There's options for long-term supports and services, including, those provided by the area agencies on aging as well as the departments on aging. They include, the other options, of course, are nursing homes, adult home help, and the PACE program. But there seems to be, more funding sent the way of the nursing homes. So we're advocating to get more funding for community-based supports as opposed to the nursing homes. The other is to expand access to My Choice and increase the rates for My Choice waiver. Our rates that we get, it's called a capitated rate system, and we get so much per person per month, and we have to use that and we do use that to provide services for folks to stay in their home as well as to pay for our staff. But as you all know, the wage situation that is expected by in-home caregivers is going up, so more funding is needed to keep up with those trends. And that is all I will add, except for I want to thank Tony. He serves on our board of directors, and some of you probably know that he's, a retired architect, so he's been such a valuable asset to our agency during this whole building project. I know there's been more than one time that I have called Tony and said, what does, this term mean? Or can you look at these documents that are many pages long? And he's been so helpful in reviewing and coming up with those questions that only a trained architect would know to ask. So, any questions for me?
Questions? Can you, just for the newer members of the committee, maybe just kind of draw a distinction between what you do and the Jackson County Department on Aging and fund sourcing, just kind of draw the distinction between those two functions and how you hopefully collaborate.
Yes, we collaborate all the time. Danielle and her team at the Department on Aging are wonderful, and we couldn't do the work that we do in Jackson County without them. We get funding from the Older Americans Act, which is a federal act, and that comes to the area agencies on aging, and from there we can provide some services in-house, or we can contract services out to other partner agencies. We contract services out. The biggest one is meals. We do not provide meals at the Area Agency on Aging. We contract with the departments on aging in each of our 3 counties to do the congregate meal sites, do the home delivered meals, and those sorts of things. There's other funding that we give to the departments on aging for in-home services, their information and referral staff. We give a little bit of funding for the Medicare Medicaid assistance program and those types of things. So we, a lot of the money we get, it goes right back out, and that's how the federal law was created. The other thing that we do is we have the My Choice Waiver Program, which is one of our biggest funding sources, and we contract with the Department on Aging to provide meals for those clients in their homes. And so those are some of the ways that we partner. But I meet with Danielle and the directors from the other 2 departments on aging monthly. We meet at the Artesian Wells, which is kind of a central meeting point in the 3 counties, and always collaborate and talk about what's happening, share ideas and best practices, and work together.
Any more questions for the Department, Region 2, AAA? Thank you for coming, Julie.
Yep.
Appreciate it very much.
Thank you.
Carry on the good work. Now, the Health Department. Madam Director, how are you?
I am well, thank you. I am so happy to walk outside to sun and warm and no jacket. So, the first item, I think that's on the agenda is, trying to make sure I have these in order because I'm going to keep you busy for a few. is a new contract, or not a new contract, a contract for the medical director. We are requesting approval for, to contract with Dr. Dennis Chernin. Again, he has been here for a couple of years now, at least last year and half of the year before. And we are super happy with him. He has been a great asset to us at the department. He works very well with the staff, especially of the personal and preventative health services that kind of need his input and advice a little more than the rest of them do. But the change this year, from this year to last year, is this year he has agreed to go for 2 years. So we're asking for approval for this contract with him for 2 years, in the amount of $5,000 per month to contract with him.
It should also be noted, sorry to interrupt, that is the same fee he has charged us for a year and a half. He is not asking for any increase in monthly stipend.
Okay, so the chair will entertain any questions or a motion to recommend the contract to the full board.
I'll move to recommend the contract.
Very good. Thank you. Let me get second on that. Is there a second? Thank you. And Commissioner Bear, please. Oh, you were supporting Commissioner Bear?
Do I have a motion and a second?
Yeah, we do have a motion and a second. Do you have comments?
Yes.
Yes, sir. Go ahead, please.
I guess overall, I'm in support of this. I'm glad Dr. Chernin is working out well for you. I have a question on the agreement, the way it is worded. It's an agreement between Dr. Chernin and the Jackson County Health Department, but the signature to authorize it is the chairman of the Board of Commissioners, which I find that problematic, that it's a contract with one agency, but a different agency is signing the contract. So I would move to change, if you get in the title, the third line down in the title, between Dennis Chernin, MD, MPH, and I would strike Jackson County Health Department, insert County of Jackson. And in the first paragraph, this agreement made and entered into this 17th day of May 2022 by and between, strike out Jackson County Health Department, brackets JCHD, and insert in there the County of Jackson, enter into a formal agreement for the provision of short-term and/or extended-term medical director services, insert the words, provided to Jackson County Health Department, meeting the requirements of that state. That's my motion to change those words. I think it provides the same thing. It just gives clarification as if the contract, the signature that authorizes the contract is the chairman of the County Board of Commissioners, then this agreement is with the County Board of Commissioners, not with the Health Department. And the services provided are, in my proposed wording, definitely provided to the Health Department. So they still get what they need, and that satisfies my requirement for consistency and authorization and signature.
Is there support for the motion?
Not to his motion, no.
Okay. Is there support for the motion? Motion fails, Commissioner Bear, but I am going to ask the administrator's view of Commissioner Bear's comments.
Frankly, I understand exactly where Commissioner Bear's request there. I don't know that it matters either way as far as the legal agreement. The County Board of Commissioners will approve it, and therefore the chair, I suppose, would sign it.
Okay, further comments to the motion that's on the floor, that being the recommendation of the contract to the full board. Commissioner Williams, you have a comment?
Nothing
Okay.
further.
Okay, very well. Commissioner Bear, would you like a roll call vote on this? Yes. Thank you.
Yes, please.
Madam Clerk, at your convenience.
Yes, Mr. Chair. Commissioner Bear.
No.
Commissioner Alexander.
Yes.
Commissioner Williams.
Yes.
Commissioner Snell.
Yes.
Chairman Plesky.
Yes.
Passes.
Thank you. Next topic then is the Health Department's organization restructure.
Yeah, so after last Monday, I presented this to you all, this restructure proposal last Monday. I did provide an updated current organization chart that moved some discrepancies of what is currently in place at the Health Department right now. Everything else remained the same, so unless you have any questions specifically, I don't have anything additional to add except answering additional questions.
Mr. Chair, I'd like to move to recommend approval by the full board.
Thank you, Commissioner Snell, and we're supported by Commissioner Alexander. Now we'll have comments to the proposed restructure. Commissioner Bear.
I have a question. You're adding a new employee paid to be coming from a federal grant, and that would be an opioid marijuana-focused employee. We already have an EYT marijuana-focused employee. So will we then have two personnel focused on marijuana?
Well, because of the programming, so EYT is Empowering Youth Today. That program and that position that you see there has 24 hours of EYT work, and then through the marijuana grant, it runs from January 1st until September 15th. So we have funding for several hours, quite a few hours, to supplement. So right now, that position is working 24 hours of the EYT program, and then supplementing the rest of that with distributing lock bags and doing community education and things for the marijuana program. To even add on to that, because we lose that marijuana funding on September 15th, she also does the SNAP Ed grant from, so all of our health educators tend to have different sources of funding for different hours of their workday, or their work week, because some of that depends on, the need at the moment. So this new position is not from a federal grant, it's from the opioid settlement, so it's settlement funds from the pharmacy companies through the Attorney General's office. That funding in and of itself is $108,000 scheduled for the next 18 years. We'll fully support that program, but we also anticipate that because there's, with the marijuana grant that we have, that we can utilize some fundings if there's from the marijuana grant for that opioid position. So there's one new position, but even throughout all of health education, some of that funding can be utilized through different programmings to complete positions and to complete the grant work of the program.
Okay, so then for 9 months out of the year, we'll have two people handling marijuana issues.
Yes.
Okay.
We anticipate they'll work together because opioid and right now our marijuana health educator who works in that program attends Drug Free Jackson. We don't really need two people to attend Drug Free Jackson and to serve on those kind of commissions, but one person, if they work together, then they could potentially go to a collaborative like Drug Free Jackson and have information on opioid and have information on marijuana to share. So I added the marijuana in there because it's a similar topic. I want to approve that those funds that will not be that person's primary focus. That person's primary focus will be opioid, but we anticipate because of the similar topic.
The organizational chart, at the start of this school year, we added 3 school liaison people to the health department staff.
Mm-hmm.
Where are they in this organizational chart?
You'll see them in the colored one, you'll see them with the arrow that moves from the personal and preventative health section. The long arrow, it's number 4. They move over to the health educators. Their funding has been approved for the next 2 years. But what we're finding right now with the decreasing COVID cases, they were brought on to do a lot of contact tracing and things like that directly with the school. Right now, they're doing a lot more education and things with the school. So they are moving to that division, or I'm proposing to move them to that division so they can work more in collaboration with the people who are in the schools and the other employees who work with those and do programming within the schools.
Okay, so they're
still there, yes, for
their
the
job
next 2
duties
years.
have changed slightly.
Changed slightly, still a COVID focus. They're actually changing, and we'll see how that goes, because that grant line through the state is now called Emerging Threats. So right now, everything they do still has to work on COVID, but we anticipate that may, expand a little farther.
Okay, that makes sense. Thank you for that explanation. On the sheet that shows your financial ramifications of these proposed changes, if you take the first add line, compare that to the second add line, the first one starts out with a base salary of $88,000, and the total employee cost is $120,000. The second one starts out with a lower base salary. Instead of 88, it's 83, but the total employee cost is up. It's up at 126 over the 120. Can you explain to me how we're getting from the employee annual wage to the total employee cost?
I don't have a specific answer on that. I don't have the breakdown of exactly what's entailed in that. I can get it for you. What I can tell you is that starting salary is lower due to the step, and then I don't know what the all is entailed, and maybe I don't know, Mike or Deborah could answer something in that.
All right, well, if you could provide that later, it
Sure.
just doesn't seem logical to me that the lower employee salary ends up being the greater total employee cost.
If I might, Karen, Kristen, I'm sorry. It seems to me when we had this presentation, one was under the pension plan and one was not. There was some fringe benefit.
That's not
difference.
actually those two, though. That was
Okay.
that's one of the gray lines. That's the delete person.
But an easy example, the one person could be a single person employee, no family, and the other person could be a full family. Just the change in health insurance and stuff.
And when
costs.
that budget is created for that person, we did that as the more expensive person there is the vacant position. So we will be going out. So when I didn't think about it that way, Mike, but so you're correct, that would have been calculated at the highest cost that we would bring that person in at that time.
Okay.
Yes, and the reality may be different.
All right, thank you for those explanations.
Any further questions then? To the motion being to recommend this reorganization to the full board. All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
Now on to the monthly report.
Yeah, so my monthly report, you'll see it's in the same format as last month. I think I'm going to keep this unless you have any additional, responses to that. I kind of like the bulleted. I feel like it's a little easier to read for you, a little easier to gather, the data that kind of matters instead of lost in words. So we'll start there, and I'll go through. If you have any questions, feel free to interrupt me, because I won't read every bullet point that you all can read for yourself. So our WIC program, one of the overarching things you'll hear from me today is a lot of our programming is focused on what's happening for the summer. So even though I have our WIC information on here and where we are with our current numbers, one of the things that we are setting to focus is on our Project Fresh program that provides vouchers for WIC clients to receive fresh fruit and vegetables in the summer. So we're doing a lot of planning around that. that. Last week and last month, I probably mentioned outreach and stuff towards kindergarten roundups. We spend a lot of this time at the end of the school year, especially with school programming things, kind of winding down on some of those, but also beginning to look forward to next year. So kindergarten roundups, where we're looking for our WIC personnel is there, go to the different roundups around the county to do outreach and find, where there are needs and how we can help those. Health education and our Empowering Youth program and our Teen Outreach Prevention program. Again, very, very strong focus towards the summer. Our programming within the schools is winding down. Our last program will end at the Hunt Elementary School. They go a little further than the others. They're the year-round school, so it goes a little further into June. But I attached as well a flyer for our Get Real program, so lots and lots of planning going on to get ready for the Get Real program, which where we have teen mentors and coordinators who provide outreach programming for 10 to 14-year-olds in the community. So they have to prepare all of the service learning projects and field trips and food and all of that preparation for that program to go on during the summer. It's a 6-week program. So as we wind down one area, we increase and jump into another. Our teen pregnancy prevention, at the very end of this slideshow, you'll see that there's, that this month of May is Teen Pregnancy Prevention Month. So our coordinator, Jasmine Isaac, will be on JTV with me late in a couple weeks to talk about all the different events and all the different outreach programs and things we do for teen pregnancy. She was just received some accolades from MOASH, which is the organization for adolescent sexual health, for some of her programming that she's doing with the schools and the students. So good stuff happening there. Our SNAP Ed program, which is the program I just mentioned a few minutes ago that kind of supplements. It's a program that works on education, nutrition. We have primarily focused on the Head Start programs in the community. For that, we are working with to get some additional hours. We've actually upped our hours that they're going to allot for us to do that programming from about 150 to 300. So we'll be looking to add more opportunities for that program to be in different areas. On the slide with the medical marijuana grant, the health education grant, I included, she was not in this morning, so I couldn't grab one of the bags, but I was curious because right now, because the medical marijuana grant is functioning at this moment, and we are handing out, and I'm giving you numbers for the lock bags that we use. I wanted to bring one, but I could only provide a picture for you, but over a certain number of grams of marijuana, you are required to have it locked and safe for, if you are a purchaser of that, you are required to store it safely. And so our grant allows us to distribute boxes or these bags to individuals who request it. They watch a video and then have to take a test, a little quiz to prove that they received, information on the standards of care with that. So we have given out 50 of those. We're also working with the WIC, our WIC clients, that if we know that someone in the home is a user of marijuana, we have educated our WIC clients to direct them to our health educator there, so she can get in touch with them, or if they so choose, she can get in touch with them to get them a bag. Hearing and vision program, those all except for one, the coordinator, work through the school year only, so they'll be off here soon. And then our coordinator will be preparing for hearing and vision program in the school next year. Clinical services, our sexual health information is there, communicable disease, which includes COVID. Our COVID numbers are still low in the Jackson area. They are slowly increasing, but still low, and all of that data is there, as well as a link to the website for additional information if you want more of that information on there. Our community health programming, this is an area that in my proposed plan will switch to the health education, because you'll see they do a lot of outreach in the community with their programming. So their programs continue to go on. Environmental health, when you talk to anyone in environmental health right now, this is their busy season. So as the weather breaks, the soil erosion permits start, the water permits start, the inspections start. We just, at the end of April 30th, was all restaurant inspection licenses, their fees were due. So it's a busy month, busy time down in environmental health. The last slide on here is the public health in the spotlight, where I already mentioned that teen pregnancy is our focus of the month. It's Teen Pregnancy Prevention Month nationwide. So you'll see if you look at any social media for the health department, although other programming are still posting on there, our big focus is on educating the community about what's going on with teen pregnancy prevention. Any
Questions for Kristen? I've got a brief one here, Kristen, with respect to the lockable bags. Conceptually, it seems to me that that's something that ought to be handled at whatever organization is selling the product. Tell me where the money's coming from and where it's going.
The money is a grant from the state, from the taxes received. This is for medical marijuana sales, whatever portion was set aside when that was approved through the fund, or through the state, we receive a portion of that allocated based on I think the allocation is based on the number of dispensaries and things like that in our area that's allocated to us.
So to soothe me, I suppose those who are buying the product are effectively paying for it because it's coming from the tax revenues they're paying.
Yes.
That makes me feel a little better. Any other questions for the health department? Commissioner Williams.
Not a question, but just a comment on the Get Real program and things of that nature. I'm just really excited to see that program continue, as I'm a big proponent of youth programming. Get Real program, again, is a program near and dear to my heart. I was involved with some of the beginning stages of that, and was even, while I was in college, was employed through the Get Real program. So to see that still continuing even today, and then to see it grow and evolve over the years it's a great thing, and I'm really appreciative of this program. I guess I do have a question. With that being said, seeing its continued growth, and again, as I said, how it's expanded over the years, when anything grows, generally there is a cost associated with that. So I'm wondering what the financials for the Get Real program looks like now and in the future.
That, again, is all allocations from the state for the Empowering Youth program. So that's built into our Empowering Youth today, or EYT funding. So we receive funding specifically for the school-based programming that goes through the school year, and then there's a separate line that comes from. And without, if I speak off just what I know, I can check further into it, but my guess is that is all based on a number of students enrolled in the program from year to year. So if we continue to see growth, if we see growth, which we are hoping to see growth in the program, and can, prove that we are meeting those needs and meeting those goals of the program, then we could potentially receive more funding from that.
Okay. And then in terms of your advertising, I'm sorry, Mr. Chair, one final question. In terms of your advertising, how are you doing that? I know there's a big push on social media. I see it all the time. But are we, by chance, sending flyers to churches and schools, those kind of things?
They should be. We are highly visible in the schools, and with the schools especially, those who have the programming within the schools. Those health educators are so connected within that schools. And even the Empowering Youth today serves the younger middle school, 5th grade to 8th grade or so, and then our teen pregnancy prevention, the TPPI programming, is targeted more towards the high school age students. So even together, they work a lot together to get that information out. And the teen outreach program, there's the coordinating council. I don't know if they're called a council or an alliance, I'm sorry, but they those students are a big push for spreading the word and doing, and being the, although they're the high school age, but sending that, getting that message out as well, so.
Okay, great. So yeah, I would also, on top of those efforts, again, I see it on social media all the time, so, and that's great. I would encourage you to send flyers to area churches, Martin Luther King Center in Jackson, the Booz Recreational Center, also in the city of Jackson, just to help get the word out, so that we can continue to see that youth support as well.
I'll make sure they know that. They may or may not already have met some of those, so, but I'll make sure, that's where they're, that
Okay.
they're focusing that effort bigger than just social media, so
That'll work.
absolutely.
Thank you so much.
Sure.
I have nothing further, Mr. Chair.
Thank you, Kristen, for being here today.
Thank you.
We move on now to the committee's claims. Chair will entertain a motion. Support. Thank you, Commissioner Snell and Commissioner Williams. Any comments on the claims? All those in favor will please say aye. Aye. Any opposed? Thank you. For committee members, please take note of the DHHS board meeting minutes attached to the agenda. And next month's reporting schedule, we'll have the DHHS Medical Care Facility Medical Examiner and Veterans Affairs. We're now up to public comment. Is there any public comment? Any public comment? Public comment is now closed. Now up to committee member comments. Are there committee member comments?
Mr. Chair, just briefly, just
Commissioner
more or
Williams.
less, just a quick statement. I was going through some old notes that I had, and I was informed by some individuals at the library, as well as, I'm trying to remember what that was, Community Action Agency, who are not necessarily direct county assets, but they have reached out to me on a couple of different occasions asking to come to this meeting and to present either a biannual or annual report, just a brief summary of kind of what they're working on. So just wanted to inform you, and then we can make further decision on that. I think Mr. Chair has his hand up as well.
Mr. Shawell.
I have been in contact with the district library. I informed Deborah and Michael to their want to come. They canceled May and chose to get back with us in an attempt to do June or July. So we are working on the possibility of the district library coming in and presenting here. Yep.
Any other commissioner comments? Hearing none, we'll stand adjourned to the call of the chair.